Bismillah ar-Rahman ar-Rahim. My name is Fatimah Sakhin, batch 12. I'll be presenting today my advanced educational seminar topic, which is what are the techniques that provide pain-free local analgesia for children, supervised by Dr. Hana Al-Busaili. Special thanks for her cooperation and support. Outline. Starting with the introduction, dental treatment of children requires successful management of anxiety and pain in order to have a cooperative child who in the course of time will grow up with positive experiences of dental treatment. In adult studies, strong correlation has been established between dental anxiety and negative dental experiences in childhood. Thus, dental practitioner should always keep in mind that beyond providing treatment for children, their responsibility is also to influence a generation with positive attitude toward dental health. Management of anxiety and pain in children. The spectrum of anxiety and pain control start with behavior management techniques, which are prerequisites for all types of treatment in children, regardless of any basic intervention, for example, examination or prophylaxis. Behavior management techniques, along with appropriate communication between the child and the clinician, ensure a reduction in the level of child's anxiety. Behavior management techniques are strategies of behavior therapy that are modified for dental setting, apart from psychodynamic and humanistic therapies. Contemporary approaches for pain-free local analgesia. In recent years, researchers have been encouraged to use the contemporary approaches as an adjunctive approach to the conventional, as you can see in the picture, using behaviors such as tickle shall do, voice control, nonverbal communication, positive reinforcements, destruction, parental absence or presence, modeling, systemic desensitization, cognitive approaches, relaxation, plus the encouraging perceived control, developing self-efficacy, which will be discussed in the coming slides. Using these approaches, at the end will conduct successful pain-free local analgesia. Encouraging perceived control in children. Perceived control in the dental environment for pain-free local analgesia is an objective control of a freedom given to a child whereby the child can stop the clinician at any time he or she feels discomfort or pain. However, this freedom should be allowed for negative and positive stimuli, and the child should be encouraged frequently to inform the clinician whenever he or she has something to tell, feels tired of keeping their mouth open, needs a short break for the water closet or the toilets, feels a bad taste in the mouth, feels any discomfort or pain. Children may overuse this freedom to stop the dentist until they learn to trust the practitioner, who at all times must be ready to respond quickly when it's used. A signaling device, motor signaling such as lifting a hand, or vocal signaling such as saying can be used in the perceived control technique. The clinician should periodically remind the child about this freedom. If you want me to stop for any reason, you can say or okay. Developing self-efficacy skill in children. At the first appointment, both child and family were whether the child will cope with the dental treatment or not. It is important to alleviate their worry for success promptly, which is turn gradually develop self-efficacy and ensure success in the future session. The dental environment, with its related characters, instruments and medicaments, clothing shapes and odors should be presented to the child. The child should also receive a constant reinforcers such as verbal, vocal, and non-verbal appreciation in every successful step of the sessions to promote improvements and cooperative behavior such as, I am very impressed by how wide you can open your mouth, or to the parents, I do appreciate your child helping me like this. Atmosphere of success should be created as soon as possible in the presence of parents. After the application of topical analgesics, the syringe should be introduced. At this stage, no need for real injection. The syringe can be put into the child's mouth, first with its cap in place, thus allowing the child to become familiar with the device. The operator can also address the parents with, wow, dear daddy and mommy, can you see how helpful your child is? Like a frozen, congratulations, in order to increase the self-esteem and also to distract. Once the tooth has already been put to the brief sleep or short sleep successfully by using topical analgesics, the child should receive a social reinforcers such as praise with words, touching on the shoulders, and the session can finish with a material reinforcers such as stickers or small toys. Strategies for preventing fear of needle. First, no negative conditioning. The puncturing in an anesthetized tissue will produce a painful reaction. The tissue has to be anesthetized first with the topical analgesics. Never administer an injection without first applying a topical analgesics. Second, step-by-step approach. Don't provide an injection at the first appointment. And always start with the most comfortable site, posterior maxillary buccal infiltration. Analgesics pathway. Pain-free injection might sound strange, but with appropriate use of topical analgesics and a slow patient injection technique, a pain-free injection can be established. During injection, start with puncture of the tissue using a fine needles. Then deposition of the solution should be as slow as possible using a low-pressure injection. Then advancement of the needle are the physiological components that give pain to the patient. The strategy should be as slowly inject a small amounts, 1 to 2 drops, wait for a while, then advance the needle slightly further, and slowly inject another 1 to 2 drops and slightly advance the needle again. Successful techniques depend on important steps. 1. Anxiety control. 2. Selection of proper material and equipment. 3. Dehydration of the tissue by air spray or cotton to allow better absorption of the topical analgesic solution. 4. Isolation of the tissue with the cotton rolls to prevent any leakage of topical or local analgesic solution with a bad taste. 5. Application of topical analgesics for a minimum duration of 2 minutes. 6. Injection by creating an analgesics pathway. Some sites in the mouth are easier and more comfortable for patient, thereby permitting a better first local analgesic experience for the child. Whenever possible, local analgesic experience should start with the most comfortable site, which is generally accepted as the posterior maxillary buccal region, followed by the mandibular buccal or labial regions. Palatal, lingual, and mandibular block injection have been found to be most uncomfortable and therefore should not be the injection of the children's first experience. For lingual and palatal injections and direct approaches via interdental papilla following the analgesics pathway will give a more comfortable injection for most children. Further developments for pain-free local analgesia. The type of syringe is important because each has a different characteristics and which has implication for both the operator and the child patient. A syringe should have ergonomic design for ease of injection and aspiration and provide a good sense of control for the operator. It should all allow slow and low pressure injection. First device is the computer-controlled local analgesic delivery system or the Combudent. In 1997, the wand was the first to introduce such a system into dentistry. Advantages: provide controlled delivery of local analgesic solution at a constant and different speeds, allow minimization of the pressure to the tissue, allow painless anesthetizing of area of the mouth. The lightweight handpiece is more tactile and allow better manipulation. Disadvantage: high cost. Second is the jet injector, needleless syringe. Needleless character make jet injectors as superior and attractive to other syringe, provided by jetting under high compressive forces instead of needle insertion. It has a valuable alternative in pediatric dentistry. As you can see in the picture A called Injects and picture B called Magic. Disadvantages of this device is the high cost, possible post-injection wounds, high sound level, and unpleasant taste. Third, intraligamentary injection, PDL injection, is administered into healthy periodontal ligament with the syringe special design. It prevents the numbness of the soft tissue. It has rapid onset, less traumatic than the conventional block. Disadvantage of this injection: conflicting data are reported about its use in primary teeth where the permanent tooth pod is present. In the picture is the intraligamentary analgesia, allows application of the minimum volume of the local anesthesia directly at the treatment site. Fourth, eutactic mixture of local anesthetic, IMLA, is a topical analgesics that contain 2.5% lidocaine and 2.5% brylcaine reported success in the medical field and oral tissues, but disadvantage is in the intraoral use of the amla cream is still not recommended by the manufacturer as the safe dosing amounts for mucosal application are not known. Electronic dental analgesia (EDA) is an pharmacological method of pain control. It's called also electroanalgesia or transcutaneous electrical nerve stimulation. The mechanism of action is based on the gate control theory. It is the electrical stimulation of the large myelinated nerve fibers that closes the gate inhibiting the transmissions of pain signals from the small unmyelinated nerve fibers. Researchers reported successful results in pediatric dentistry. However, lack of interest among most clinicians and companies to marketing ADA for dentistry. Intraosseous injection, delivery of local analgesic solution directly to the cancellous bone, adjacent to the tooth to be anesthetized. It's performed in 3 steps: mucosal analgesics, perforation, and injection into the cancellous bone. The main advantage of the intraosseous injection is that it provides analgesics for 1 or 2 teeth without lip, tongue, cheek numbness. Disadvantage: requires special device, lower success rate in inflamed tissue, risk damaging permanent teeth germs, and require informed consent. Home message: creating a strong connection on the child's first visit helps to create a comfortable atmosphere in which the child does not feel threatened. Therefore, it is important for the dentist to establish a friendly relationship with children in order to combat patient fears and to deliver effective and efficient treatment. References. Thank you for listening.